Hello, everyone. Thank you for joining the End of Life Care Program update. My name is Shruti and I am the PACE Project Officer. You can't see me, I didn't fit in the camera, but I will be moderating the session today and I will be assisting the End of Life Care Program update team to deliver this webinar for you. Before we continue, I would like to acknowledge all the traditional custodians and owners of country throughout Western Australia and recognise their continuing connection to land, waters and community. We also pay our respect to their elders and extend that respect to all Aboriginal people living and working in this area. Just some housekeeping. If you could please pop yourself on mute. And maximize your screen so that it prevents any distractions. Also, if you could please sign in using your preferred name, that just helps us interact with you better. If you have any questions or comments, please pop them in the chat and we'll address them. You are welcome to use the reactions function on Zoom as well if you like. Now I will hand you over to Nicole.
Okay. Okay, good afternoon, everyone. We'd also like to acknowledge the traditional owners of the land on which we meet on today, the Whadjuk people of the Noongar Nation. We would also like to pay our respect to elders past, present and emerging. So today, the team and I are going to give a little bit of an update on the End of Life Care program. So these are the topics we'll be covering today. We'll start off with some background information and then go into our topic areas of advanced care planning, palliative care education, and voluntary assisted dying. To start off with, a bit of background. So all of the documents you can see on the screen are just a few of the documents that guide our work. So there's a number of key state and national frameworks and policies that guide our direction. Notably, we have the Joint Select Committee on End of Life Choices. The final report was tabled in 2018 and it had 24 recommendations, which quite strongly guide the direction of our team. And we also have the Joint Select Committee on Palliative Care, which was tabled in 2020. So our team continues to implement the recommendations of those two reports in particular. We also have the Sustainable Health Review final report, which was released in 2019. It outlines 8 enduring strategies and 30 recommendations to prioritise the delivery of patient-centred, high-quality and financially sustainable healthcare across the state. Most relevant to the End of Life Care program is Enduring Strategy 3, which is Great Beginnings and a Dignified End of Life, noting that our work also aligns with a number of the other strategies as well. So under Enduring Strategy 3 is Recommendation 9, Achieve Respectful and Appropriate End of Life Care and Choices. So a lot of our work aligns with this recommendation. Our program also provides statewide strategic direction through the WA End of Life and Palliative Care Strategy 2018 to 2028. So on the screen, you can see the priorities from the strategy there. And the vision of the strategy is to improve the lives of all Western Australians through quality end of life and palliative care. And you will note that our work links back to these priorities wherever we can. So now we'll move on to advanced care planning. Sorry, I didn't introduce myself. My name is Nicole DePraser and I'm the Principal Policy Officer that looks after advanced care planning within our team. So I'll just give you a bit of an update on what we've been working on in that area. So in terms of advanced care planning, our project is really guided by the recommendations from the 2019 Ministerial Expert Panel on Advanced Health Directives, as well as the previously mentioned JSC reports. So our project has gone through several stages. Initially, we focused on the drafting of a revised Advanced Health Directive form with an extensive consultation process. Then this was followed by the development of a broader suite of resources and preparing for the implementation, with the launch of the revised Advanced Health Directive and resources in August 2022. And then there was broad promotion across settings. So we've now moved into an ongoing implementation phase, ensuring that the resources are being used appropriately and that ACP is embedded into practice. A key document which we've developed in our work is WA Health's strategy for advanced care planning, education and awareness raising. It was developed about 4 years ago, and the purpose of the strategy is to outline WA Health's approach to advanced care planning, awareness raising, training and education for health professionals in the community. It provides a holistic view of what's required in WA, and although it's primarily used to guide WA Health's work, it may also be a useful resource for other services and organisations as well. So a major focus of our team is maintaining the suite of advanced care planning resources for WA that I mentioned were launched in 2022. So we monitor the use of the resources and continue to make minor amendments to improve their usability based on the feedback that we receive. So this includes advanced care planning documents that people can use to record their values, preferences and decisions for advanced care planning, and also general information resources. This flowchart is an overview of the types of advanced care planning documents that can be used in WA. It shows who the document's completed by and whether they're statutory, non-statutory. So it's just a useful tool to try and understand the many documents and how they relate to each other. I'll briefly just go through the specific resources that we have in the range. So first we have the Advanced Health Directive. As I mentioned, revised version released in 2022. So this is a legal document that's completed by a competent adult and contains decisions regarding future medical treatment. It specifies the treatment for which consent is provided, refused or withdrawn under specific circumstances, and only comes into effect if a person requires that treatment and is unable to make decisions at that time. And although it appears to be quite a long form, individuals can cross out any sections that they don't want to complete. And there is a lot of space provided for actually completing each question. So it appears a bit longer than it actually is. There's a detailed step-by-step guide that was developed to accompany the form. And this guide's also been made into a video series for those who prefer a more audio-visual format. We also have a suite of other advanced care planning consumer resources. So we have Your Guide to Advanced Care Planning in WA, which is a workbook to facilitate discussions. And the consumer guide walks people through things to consider about their health, values, preferences, and future care. So it's a useful resource for people who might just be getting started. There's also a number of web pages, videos, and brochures that also provide good introduction information. The Quick Reference Guide to Advanced Care Planning resources in WA summarises the main resources and explains when they might be useful. So similar to the flowchart that I showed earlier, it's a useful tool for both health professionals and consumers for deciding what form might be right for them. In terms of advanced care planning resources for health professionals, we have a number of different resources. We have the Health Professional Guide to Advanced Care Planning in WA. So this is really sort of the most useful overarching resource that describes the roles and responsibilities of health professionals. It's a large document, but it is broken up into sections. So you can look for something in particular, or there is a 2-page summary at the front, which is also useful. We also have a couple of short videos on the website for general information, and a mini audit tool was developed in collaboration with RACGP to allow GPs to audit if advanced care planning conversations are being had with patients who would benefit from them, and if so, are ACP documents being adequately stored. So this exercise can help identify actions that practice teams can collectively take to increase effective ACP and AHD conversations, and it includes a pre-filled quick log for earning CPD hours. So in addition to maintaining resources, another major focus area of the project is general awareness raising and education, and we work with other organisations where we can to achieve this. So for example, we work with the Cancer Council, who's contracted by the Department of Health to deliver education sessions such as this through PACE. We also identify ongoing opportunities for one-off education sessions, such as webinars with key organisations. We have ongoing communication via our legal advanced care planning subject matter expert group. And we also have a contract with Palliative Care WA, who deliver workshops to the community. And we're currently funding a 6-month pilot of a support service that offers individual and group assistance to people with completing their advanced care planning documents. So there's a number of different methods of support that's provided through that service that you can see on the screen. We also have ongoing work to ensure consistency across jurisdictions and settings. So a few examples, we've been working closely with WAFA to support their Greater Choices at Home Palliative Care project, which is about embedding ACP as part of routine practice at several GP practices, including embedding it as part of the 75 plus health assessments. We also support WAFA's sensory loss project, which is being run by Palliative Care WA, and it's looking at the advanced care planning needs of people with sensory loss. As a result of that project, one of the recommendations was the development of information in easy read formats. So we're in the process of creating an easy read version of our advanced care planning fact sheet at the moment. We've also been participating in the Australian Digital Health Agency's Advanced Care Planning Discovery Project. So this is a national project that commenced last year and involves a series of consultation workshops to determine the current state and issues of advanced care planning across jurisdictions. And it's working towards some possible solutions and recommendations. And we'll soon be participating in Advanced Care Planning Australia's national jurisdiction meeting as well. There's also a focus on goals of care within our current work. So mid last year, thanks to some project work with WACS, we released information on both health professional and consumer Department of Health web pages on residential goals of care. It includes an implementation guide, and any residential aged care homes that are interested in using the form can contact us for a copy. And we recently re-established the statewide Goals of Patient Care Working Group. It has representatives from health service providers, as well as health support services, GP and carer reps, and some private hospital representation. So the first meeting was held in February this year, and the initial priority will be to review the content of the form itself. And we're also having some discussions to try and achieve consistency in the version of the Goals of Patient Care forms that are used across WA Health. So just to wrap up, a few key learnings and useful reminders that come up in our work and our role. Advanced care planning is a voluntary process, so it is not mandatory for anyone to complete an advanced health directive, but it is important to embed opportunities for advanced care planning into practice wherever possible. It's important to review local policies and procedures to ensure that advanced care planning documents are adequately identified, stored, and enacted. And advanced care planning is an ongoing process that does require multiple conversations and review. Advanced care planning is focused on the person's values, priorities, and preferences, and encompasses more than just the completion of the ACP documents. So the conversations are just as important. And wherever possible, we do recommend to refer to the WA Department of Health Information and Resources for the most current and up-to-date information. And there's our contact details. If you'd like to order any free advanced care planning information, advanced care planning resources, you can do so through the information line. And then they're also available to download on the website there. I'll hand over to Marnie.
Thanks, Nicole. My name's Marnie Chalu-Hawley. I am the Principal Policy Officer for Palliative Care. We're a relatively new team in palliative care. I started in February, and we have a senior project officer and project officer that came on board shortly after that. But luckily we have a clinical lead, Dr. Alison Parr, who we work closely with, and also Barbara Voigt, the palliative care nurse educator. So our focus over the next 3 years is really around the strategy that Nicole's already mentioned that runs to 2028. So one of our first pieces of work as a new team is developing the implementation plan number 2. The first implementation plan covered 2020 to 2022. So we'll be building on the work from that, and we refer to that as IP1. And also there was a collaborative forum back in June 2023 that aimed to identify the remaining gaps against the strategy and also future priority actions as well. Our plan is to have the implementation plan number 2 out for consultation, hopefully in June, and then released later this year. The second piece of work will be the National Partnership Agreement projects under the Comprehensive Palliative Care and Aged Care program. Those projects are continuing to 2026, and we have 2 projects in particular continuing to 2026. And the aim of those projects are improving palliative and end-of-life care coordination for older Australians in RACHs. There's always work in the policy space, so we take up any opportunity to provide palliative care policy input and advice into new initiatives and emerging issues. At the moment, there's some work around the new Aged Care Act that comes into place on the 1st of July, particularly the end-of-life pathways in the support at home program. So we'll be focusing on that. And also there's some work in the National Dementia Action Plan implementation as well. And then there's always local initiatives that we try and get involved in where we can and provide some palliative care advice in. The fourth piece of work, obviously, as we come towards the end of the strategy in 2028, we'll be reviewing what we've achieved to date, and that'll involve looking at palliative care data and measuring outcomes. There's also a little bit of work we need to do on the ePalsys system. So ePalsys is used by health services to collect Peacock data. So we'll be working on that. There's some upgrades and some e-learning packages that we need to finish off. So as I mentioned before, the NPA projects are about strengthening national and state efforts to improve end-of-life and palliative care provided in residential aged care homes to their residents, families and carers. So in 2021 to 2024, we had quite a few projects running under the NPA. That included the MPACS expansion, the RACE PC education and training for aged care workers, which comes under PACey. There was also the WAFA case conferencing coordinators in RACHs. And then, as Nicole already mentioned, there was residential goals of care for WACs, residential care line expansion. And in the metro region, we also had metro HSP transition coordinators that looked at that hospital to RACH interface for residents. And then we also partnered with RACGP to develop a GP resource around providing palliative care in aged care homes. There is 2 evaluations going on for that NPA. The first one is the national evaluation, which is being done by the NOUS group, and WA have provided input into that evaluation, and the final report's expected for that later this year. At a state level as well, we contracted the Parent Institute to do an impact evaluation on the NPA projects in WA. That report came out at the end of last year, and I'll cover that in the next slide just so people can see what the outcomes of that were. So 2024 to 2026, as I mentioned, we have 2 projects that will continue under the NPA, particularly the MPACS and the WAFA case conference coordinators, but that project will occur within new RACHs. And then after that, after 2026, obviously that will be depending on what happens with the Commonwealth. But from Department of Health's perspective, it's about ensuring that sustainable elements of those projects will continue in some form in the future as well. So as I mentioned, from the state evaluation perspective, Parent Institute were contracted to do the impact evaluation and also provide recommendations for long-term planning as well in aged care homes. There were 3 phases to the evaluation. The first one was consumer survey, which included bereaved carers. The second one was focus groups of service providers talking about the consumer survey findings. And then the third piece was RACH staff survey on the NPA initiatives themselves. The evaluation noted that palliative care services improved the experience of residents and their families on most aspects of care compared to residents that did not access palliative care. And there was also some positive outcomes in terms of NPA sites compared to the non-NPA sites for particular staff reported outcomes as well. So I've highlighted 4 of the service improvement recommendations from the report. First of all, there was enhancing communication with and support for families and carers. The second one was building workforce capacity and capability, obviously taking into account workforce issues within aged care, particularly around retention. Improving care coordination, including ACP in the community, and also improving end-of-life and palliative care quality, particularly through MDT expansion and grief and bereavement support. And the last slide here is just a reminder of all the documents. I think some of them Nicole has already touched on, but one to be aware of is the new framework for bereavement support after an expected death in WA. That was released earlier this year and is available on our website. And then there's also existing frameworks, including the Aboriginal End-of-Life and Palliative Care Framework, the framework for people with dementia, and then also 2 paediatric documents as well. And these are all available from our website.
Good afternoon. My name is Barbara Voigt, and I am the Palliative Care Nurse Educator for the Department of Health and the Cancer Network WA. So education is very important with regards to what has already been discussed by Nicole and Marnie. And I really like to emphasize that palliative care is everybody's business in healthcare. There is a big push for all healthcare professionals to have some basic knowledge of palliative care, because we're all having to care for people who are heading towards end of life due to an increased aged care population. So it's a very important aspect of palliative care. Firstly, I'd like to say that education and training in end of life and palliative care for health professionals is critical to support end of life and palliative care quality, access, and early conversations about meaningful end-of-life choices. The WA Department of Health website for palliative care and end-of-life includes the end-of-life and palliative care framework, which has discusses many aspects of what we're working on and what's really important to palliative care. And this guides the user to assess their own knowledge and skills on palliative care and to select a domain to promote professional development in palliative care. So here we go. There are 3 end-of-life, 3 domains to choose from, and each domain has learning items that are grouped into a learning focus area. Each of these are then divided into 3 different levels of expertise. 1 is the foundation level, 2 is consolidation, and 3 is the extension. Each level increases in its complexity and level of skill. So as you gain knowledge in each of those domains and groups, it then helps you to comprehend the next level and then the next level and so on. It's not limited to just one area of care, but many areas of care. So palliative care is carried out in the primary area, acute area, community, disability, mental health, etc. Wherever it's required, palliative care is there. So it's really important for all health professionals across all areas to be learning about palliative care. The WA Department of Health's end-of-life care program and the Care Search, which is an online website, have worked together to create a digital solution for an interactive end-of-life and palliative care education and training framework for WA health professionals. This includes health professionals working in primary care, hospital, community, and aged care services who care for people at the end of life. It provides an easy and efficient pathway for time-poor clinicians to identify and address education and training gaps by connecting them to relevant learning resources within the Care Search portal. So if you have a look at the screen there, we have the Government of Western Australia Department of Health with regards to that end-of-life and palliative care education training framework. And there are also tools there for advanced care planning, training and resources. And Care Search is the palliative care knowledge network. And it is a very broad area of resources that can be accessed for palliative care. Other areas and resources that you can access are, of course, PACE WA through Cancer Council WA. And they carry out a lot of training programs with palliative care. You've got IPEPA and PEPA, and they are looking at the regional areas and the Aboriginal care areas as well. LDAC looks at aged care, and End of Life Essentials is run by Flinders University that looks at palliative care for all healthcare professionals across Australia, and particularly in the acute areas of palliative care. And there are quite a number of others. There's also LGBTIQ plus Health Australia that looks at those areas for the more marginalized areas of palliative care. And we also have reference to talking end of life with people with intellectual disability and so on. My role in palliative care is to facilitate and promote healthcare professional awareness. And I do this via the Australian Department of Health, where we expect all healthcare professionals to have that understanding of palliative care in order to identify when a patient or a resident requires palliative care management. It is no longer achievable for everyone to receive a palliative care referral, and wherever a patient is cared for and requires symptom management or end-of-life care, that general healthcare staff are able to provide the necessary palliative care in line with general palliative care standards for all healthcare professionals. So if you look back at the palliative care standards, there are two standards, one for all healthcare professionals, and then the other set of standards is for specialized palliative care professionals. So when we're talking about staff in hospitals, staff in residential aged care, and so on, you need to be referring to the generalized palliative care standards, which will guide you on what is essential in providing that palliative care. As part of the education role, it is also important for me to ensure that everyone is well informed on all matters palliative care that are trending and emerging around the world, within Australia, and that are relevant to the challenges of healthcare within WA. So I will review all of these items that come up and select suitable ones that apply to WA Health. The WA Department of Health Palliative Care and End-of-Life Program is seeking consistency across WA in the delivery of palliative care and end-of-life care. And this can only be achieved by ensuring that the same information is received by everybody. It is wonderful that across WA, there are so many wonderful organizations that provide palliative care, but we do need to keep consistency because the expectations from the WA population is that we do it well. And if we follow the correct guidelines as produced by the WA Department of Health, palliative care can be done exceptionally well in all areas of WA, including the regions. So finally, education in 2025, what have we achieved so far? We are connecting with healthcare professionals to provide palliative care education within acute care areas around WA. This is via hospitals. I've started to do this, and I will be working my way through as many hospitals as possible in the next coming months. And this also includes the distribution of WA Department of Health palliative care resources, which there are many of. When you go onto the palliative care website for WA Health, you will see many of these resources. You can actually request those as well via the website. Participation in the promotion of advanced care planning, voluntary assisted dying, goals of patient care and palliative care matters. I'm collaborating on content with PACE and RACPC with regards to education content. And I'm also updating palliative care resources where I'm assisting in updating these resources, which is in progress. So we're looking at currently opioid conversion lanyard process that's been updated and improved. The development of updated intrathecal management process and patient brochure, that's in the process of being completed. That's quite an exciting space to be working in at the moment. And there's some very current information coming through on that very shortly. We will also be looking at updates to the symptom management flip chart, which will be starting imminently. So the one that we currently have has not been updated for a number of years. And we will be looking at what needs to be improved on that. And as soon as that is done, there will be new flip charts produced and sent out to all areas in WA. And finally, updates to palliative care medication list is also in progress. As you know, there's some shortages of some of the palliative care medications, and we need to update what's available and what isn't, and what needs to be added to that medication list. I'd like to say thank you very much for taking part in the processes of education in WA Health Palliative Care. And I will now pass you to Kathy.
My name's Kathy Hinch. I'm the Principal Policy Officer for Voluntary Assisted Dying within the End of Life Care team at the Department of Health. So the Voluntary Assisted Dying Act 2019 will have been in operation for 4 years as of the 1st of July this year. The Voluntary Assisted Dying Board delivered their annual report, which was tabled in Parliament by the Minister for Health on the 5th of November in 2024. And the statutory review of the Voluntary Assisted Dying Act 2019 final report was tabled in Parliament by the Minister for Health on the 28th of November in 2024. This was the inaugural review of the Act. The Minister for Health must review the Act after the first 2 years of operation and then every 5 years thereafter. So the VAD Board annual report, this was their 3rd annual report, and it includes VAD data between the 1st of July 2023 and 30th of June 2024, personal reflections from patients, family members and practitioners, and recommendations from the VAD Board. So this year they delivered 6 recommendations which are related to legislative review, reform to the Commonwealth legislation, VAD within WA health systems, workforce sustainability, public awareness, and completion of the medical certificate cause of death by nurse practitioners. So data within the report in the 23-24 period indicated that demand for VAD continues to increase in Western Australia. During this period, 970 people made a first request to access VAD, and this is an increase of approximately 28% on the previous period. 593 people then went on to complete a first assessment, with the median age being 75 years, 57% being male, and about 75% of people being in the metropolitan area, which is similar to previous years. In terms of the diagnosis categories, 71% were people with cancer, nearly 11% people with neurological conditions, 8.6% respiratory, and 9.3% of other conditions. 83% were receiving palliative care at the time of their first assessment. 335 people were supplied a VAD substance, but it doesn't necessarily mean that they will go on and use the substance. And in this reporting period, 292 deaths were due to the administration of the VAD substance, which is an increase of nearly 15% compared to the previous year. This year, in this reporting period, approximately 5% of people self-administered the voluntary assisted dying substance, and about 95% were via practitioner administration. And this is something we've been seeing climb over the past few years, is that in WA, we have a very strong preference for practitioner administration. So practitioner participation during this period. So during this period of time, there were 114 practitioners in total that have completed the VAD approved training. 103 of these are medical practitioners and 11 being nurse practitioners. So this is from the commencement of the Act in 2021 through to the end of the reporting period. However, during the 23-24 reporting period, we had 13 medical practitioners complete the training, and 4 nurse practitioners during this time. Most practitioners are based in the metropolitan area, and the most common specialty is general practice. 67 medical practitioners participated as a coordinating, consulting, or administering practitioner, and 54 medical practitioners completed a first assessment. 5 medical practitioners completed 42.8% of all the first assessments. So what we do continue to see is that there's a very, very small number of practitioners who tend to be providing the majority of the VAD services. So even though we do have a lot of VAD people, a lot of practitioners trained, we have a very small amount of practitioners who are actually participating in VAD on a regular basis. The VAD practitioners need to renew their training every 3 years, and last year was the first year when we saw the renewal training being completed. It's now in place, and we are having several practitioners complete the training. However, there are a number who have chosen not to renew as well. So the statutory review of the Act, this was a 2-part process that took place. The first part was an online public consultation survey, which was conducted by the Department of Health. And then the second part were in-depth interviews and focus groups, which were run by the Australian Centre for Health Law and Research at Queensland University. And this helped to explore themes that were raised during the survey. The panel also considered some other submissions, and following all the evidence that was provided to them, they concluded that the Act is operating effectively and did not require legislative amendment. They did make 10 recommendations to improve policy and operational processes, though. So 2 of these recommendations advocated for change at a federal level, and these related to Medicare benefit schedule items in order to pay practitioners, and also amendment to the Commonwealth Criminal Code, which limits VAD discussions via a carriage service. There were 8 recommendations that were then allocated to the Department of Health. So our strategic direction for VAD, it's a focus on VAD to make it an integrated end-of-life choice for all Western Australians. And our key priorities at this point in time are implementation of the statutory review of the Act recommendations. So the main recommendations that were allocated to the Department of Health, they have very similar themes to the recommendations also raised by the Voluntary Assisted Dying Board. And these related to community awareness, improved information about how to make a first request for patients and also how to respond to a first request for practitioners, minimising harm caused by conscientious objection, optimising access to voluntary assisted dying through the Regional Access Support Scheme, ensuring appropriate workforce resourcing, and best practice guidelines for substance management, working with interpreters, and also sharing patient information while maintaining safeguards. We have also implemented a voluntary assisted dying fee-for-service model. So the Department of Health committed to this model to reimburse VAD practitioners for carrying out VAD services, because Medicare benefit schedule items are very, very limited. However, that is our preferred model going forwards in the future. So with that advocacy with the federal government, we are hoping that MBS items will be introduced. However, in the interim, the department felt it was very important to reimburse VAD practitioners in order to reduce patients having to pay for the service, and also practitioners charging private fees. We are also looking to improve and support VAD practitioner workforce sustainability, and we have some VAD practitioner workforce forums coming up in the near future, where we can further explore what are the barriers and enablers to VAD practitioners doing the approved training, and also then going on to participate and provide VAD services. And our strategic priorities, so education and training to increase knowledge, awareness and understanding of VAD as an end-of-life choice amongst health professionals in the community. Sustainability, so big focus on workforce wellbeing and also equitable access to VAD alongside other end-of-life choices. Engagement, so to improve engagement with consumers, carers and health professionals, to strengthen coordination between VAD, end-of-life care and palliative care services, and also evidence-based policy and evaluation. So embedding evidence-based and data-driven decision-making in the implementation of VAD policies and initiatives while considering the wider context of end-of-life care and palliative care systems. And then they're just our contact details for VAD for the various services. So the Department of Health website, the VAD board's annual reports are available on their website. The review of the Voluntary Assisted Dying Act is also online, and for any patients seeking access to VAD who require assistance, they can contact the statewide Care Navigator service. Okay, and that's it.
Awesome. Thank you, Nicole, Marnie, Barbara, and Kathy for delivering the session. Did anyone have any questions before we start wrapping up? Please feel free to put them on the chat. Wait a few moments. Awesome. Okay. So we'll just go ahead and wrap up. Here's the evaluation QR code. Please take a moment to scan the QR code. That will take you to the evaluation form. It just helps us improve our education. With your feedback, we aim to use your feedback and, address any of the issues that we might have in our education. So please let us know how we did. I'll just give you a few moments to do that. Just a little bit about PACE. So we have a few different streams. We deliver education to volunteers, to health professionals that work across all sectors, including residential aged care facilities as well. We provide clinical placements through our program called PEPA, and we also have palliative care scholarships. This is one of the educations that is coming up. Please feel free to check it out. So this is called the Goals of Patient Care Education. It's a simulated education, which is highly regarded. We use professional actors that play the role of simulated patients. And you, as a health professional, basically have some time with them to practice your communication skills with the simulated patient, and you also get real-time feedback from the facilitator as well as the simulated patient. And that's it. So thank you so much for attending the session. And if you have any queries or any questions about any of the educations that we might have coming up, please feel free to reach out and also visit our website. It's www.pace.com.au. I've also put it in the chat. Thanks, everyone.